I'm approaching 45 this year. My missus has reminded me that I need to get my colon checked.
Okay.
I know it might be immature, but man don't want the finger up there.
Up where?
Is there an alternative?
No, up where? Answer the question.
Second question. I'm not gonna lie. After watching your first episode, I think I need to go see my GP and say hello after about 10 years.
I said hello. Adele, yeah?
But I'm not gonna lie. I've got mad anxiety at the thought I'm going to die. What can I do to get over it?
Okay. What advice would you give?
I'm gonna throw it back to you.
No, I'm not gonna answer. What's going on, guys? The Goodman Factory presents Checkin In. We're back again. Episode 3 this time. Unfortunately, no Arsenal top this time. Unfortunately. Today, we're keeping it a bit more general, I guess, in terms of screening programs. You might be like, what's a screening program? But we'll go more into detail in regards to that. It's myself, Kels, again. We've got Aleem. For those who are new, we're two GP trainees. We're medical doctors. Here to just help you out in regards to sort of health conditions and any questions you might have. Aleem, how are you today, man?
Yeah.
You good?
I'm good.
Yeah?
I'm good.
Yeah?
It's been a good week.
You said that like, what happened?
But yeah, you know, just taking each day as it comes.
Yeah.
You know?
I hear that, man. I hear
Night shifts, 3 in a row.
I'm sorry. I'm sorry.
Still alive.
That's for me. I'm happy, man. I've left that life.
You finished your acute med block.
Yeah,
so
I've left that life,
you're
man.
enjoying.
I'm sleeping well.
Don't worry, I'll join you in August.
You join me in August. All right,
Okay.
today we said like screening programs. And I think even saying screening programs, people think, what screening programs? How do you define that? What is that?
So, a screening program is essentially, I would say, a public health initiative to recognize people who have disease in, let's say, diseases that commonly present in the population, i.e., bowel cancer, prostate cancer. In women, we have breast cancer, ovarian cancer, XYZ. So they're essentially health measures to kind of opt people in to screening, to recognize disease and manage accordingly.
Definitely. And another big thing we said we'll touch on today, I guess, is just about chronic disease as well. And the sort of investigations that can be done for chronic disease, the things to look out for in regards to chronic disease, and why it's important as well, I guess. Even chronic disease, and it's obviously, it's not to insult anyone, but maybe that term might not be familiar with people as well. So how would you even describe chronic disease?
So chronic is essentially just an enduring illness that's essentially lasts a long length of time. But I guess when we're thinking of disease and health, I think what people are more familiar with is, let's say, mortality. Yeah. You know, whether you're alive or you're not. Okay. When it comes to morbidity.
So explain that.
So
morbidity, no one knows that.
Morbidity, I guess, is living with illness or living with symptoms of disease. Yeah. So if we were to give an example, someone who has difficulties with their heart. Yeah. Let's say they have heart failure, which doesn't mean your heart doesn't work. It just means your heart is not as efficient as it used to be. But they may start to experience shortness of breath on activity. Yeah. So if, let's say, they were an avid walker, they walk 10 miles a day, they go into hospital with worsening symptoms. They can now only walk maybe half that distance.
Yeah, so big impact on their life.
Big impact. Yeah. And let's say this person likes to walk up those hills and see this specific sunrise or sunset.
It gets to people, you know.
It gets to people, you know. People have been walking their whole life and they can't do it. What about if they're playing football? Yeah. You know, some people have, let's say, certain muscular injuries or knee injury. They can't play football. Yeah, yeah. You know, that's a big thing. Yeah. So that's when we think of morbidity. And something people need to maybe think of a bit more is vitality. Yeah. And having good health, having that element of liveliness. Yes. That kind of get up and go. Yeah. And proactiveness when it comes to your health. To health, definitely. You know, as opposed to waiting to get an illness and then having to manage the illness. Definitely. What can you do to reduce your chances? And I think we spoke earlier about sometimes genetics are genetics.
That's the sad thing. It's a bit of a lottery as well.
Sometimes genetics are genetics.
It's a bit of a lottery, yeah.
You know, some people are trying to become super hench beasts, you know, but they ain't got the genetics.
It's true. It's true.
Some people are not really trying to become that big, but they've got genetics that, you know, they don't need to put as much effort as someone else. So if we think of health,
same principle.
Some people have bad genetics. Yeah. If, let's say, type 2 diabetes runs strongly in their family, which there may be some lifestyle factors also driving that, the chances are that individual may do everything they can to mitigate the risk, but the risk is still there.
High, still there.
Other people, you know, they smoke every day.
You
know, and they never get any lung disease.
You'll get that. It's crazy.
So
it's true. Okay. So we want to touch, I guess, on let's go for the cardiovascular side of things first and foremost, and we'll break that down a little bit. Just touch on the key elements of that from the point of view of chronic disease. I guess we want to give our audience a little bit of advice to sort of avoid or reduce the risk of sort of developing cardiovascular disease. So are we going to touch on that one then?
Because we spoke about this in the first episode, but we can obviously reiterate. But healthy diet, the things you enjoy in moderation, you know.
Not too much sugar.
Yeah,
not too much puff.
Not always kenke and shit.
Oh, okay.
You know?
I can't relate to that one.
Sometimes Nigerian jollof.
You want them to die, yeah? Okay.
But so things in moderation. Yeah. Because cholesterol it's not your friend.
Yes.
You know?
And I think the Africans amongst us, cholesterol is the one that is a big problem. Our diet is cholesterol.
And I think that is the issue. I think when you tie in cholesterol, a meal which is predominantly carbs and meats.
Yes.
It's the thing is because people see meat as
it's good for you, innit? It's good.
Meat is good for you, and the carb is the energy.
Yeah.
Whereas they don't see the value of the roughage you get from, let's say, vegetables.
It's true.
The fiber. It's just it's not really. It's not necessary. But I don't know. We need to invest in our health the same way people invest in. Let's say they invest their money.
Yeah, it's true. It's true.
If you leave your money in the bank, it gets eroded by inflation. Whereas if you invest it wisely, then you might see a return on your investment. But you're doing it with, let's say, a long-term horizon. Yeah. People need to bring that to their health.
The same with
if you're not proactive, if you don't do anything, then you end up with morbidity, comorbidity.
It's true.
And we know that is not that affects quality of life.
Definitely. And then I guess we can touch on what can people do then? You've said sort of the health side of things. Is there anything they can do in terms of regular checkups or anything? Or would you say, more so focus on just living a healthier lifestyle, especially in the younger populations, I guess, where you might not really be thinking too much about comorbidities and chronic health, etc. But probably it makes more sense to start early, if anything.
Yeah. I think people need to take you need to take a lot of responsibility on it.
Yeah, it's true.
Because it's having a checkup and the doctor tells you, you're all good. And then you just continue.
You're going to chill, you're going to...
until your next checkup. Yeah. We need to consistently make good health decisions. But NHS do have the health checkup, which is, from 40 years old?
Yeah,
45.
from 40 years old, yeah.
And it's every 5 years you get a health check.
Yeah.
Whether that's doctor-led or nurse-led, I'm not too sure.
I think more so nurse-led will probably be, yeah.
And I guess they'll do routine blood tests, check your
blood pressure and
physical
things.
Parameters.
Look at your BMI, the general sort of overview, I guess, and then they'll just calculate your risk of cardiovascular disease, basically, and go from there, to be honest. One big thing we touched on is diabetes, and we won't go into the physiology and pathophysiology, etc. of diabetes, but obviously it's a big issue, not just nationally, but I think more pronounced, I guess, in our community as well, in the Asian community as well, where we're more at risk developing diabetes. It seems like, and it might seem like something simple to prevent, but it's tricky, to be honest. And I think diabetes is one that creeps up on people a little bit. What would you say in terms of advice from a diabetes point of view?
Again, it all starts with healthy life decisions. I think one thing people tend to think is if they just avoid sugar, if they avoid Haribo, fizzy drinks, when in reality, even a high carb diet.
Rice and stew.
Exactly.
Having rice and stew 4 times a day, my friend.
So it's about having a balanced diet, trying to reduce your risk of central obesity. So that excess body fat around your abdomen, is trying to reduce that.
Definitely, and it's quite a useful predictive marker as well. A lot of the times for a lot of these illnesses as well. Yeah.
And just taking a bit more responsibility, being proactive, especially if you have family members who have diabetes.
It's true. That should in a sad sort of way, you have to be a bit more diligent than someone who doesn't, in a way, just because your risk then is higher. So you need to have that awareness that, okay, my auntie and my mum and this person and that person and that person have it, then I need to do a bit more maybe than a general person, I guess. Yeah, it's true.
It's like we said, and when we were talking about morbidity, and if you're thinking of the impact on quality of life, the impact might not be immediate, but if you think of 5, 10, 15, 20, 25 years, then you start to see the effects. And whether that means that you've needed an amputation.
Why though? Why would they need amputation? Because people might be thinking that you've just jumped from diabetes to amputation. Well, what's happening?
Because the damage it does on your blood vessels. So that would increase the risk of peripheral vascular disease. And if the blood supply to those areas reduces over time, then that tissue is not going to be healthy.
And it's not just musculature, of course, but obviously retinal or eye, side of things, I guess.
Kidney
as well, kidney,
heart, brain. And one thing I tend to think of when I'm thinking, my motto tends to be live long, live well. What does that mean to me? And that means that by the time I'm retired, I want to still have a good quality of life.
Of course.
I don't want to be resigned to a nursing home. Not that I've got anything against nursing homes.
It's true.
I want to be able
most people wouldn't want to be, of course.
And if we think of, let's say, dementia, obviously there are different types of dementia, but one of the most common types is mixed vascular dementia. And all of these things increase the risks. And if you have dementia, it could get to the point where you don't necessarily have
any quality of life,
or autonomy.
It's true.
So it's about being conscious of how the decisions you make now affect that. And it's difficult because we can sit here and think, oh, isn't it easy? Isn't it common sense? Humans should just make rational decisions. But it's deeper than that. Like what drives human behavior, it's deeper than common sense. If your whole life you've been enjoying a hench portion of yam and egg on a Sunday,
So big up yam and egg, man. That's a serious breakfast.
You've not seen any effects of it.
The bulking breakfast.
So it's tricky, We all have our bad habits, and I think through understanding our bad habits and why we maintain them, we should be able to empathize with why other people have their bad habits.
It's true.
Because it's not easy to just wake up one day and say, I'm
switch up.
So what would you say? How would you encourage someone to try to make what you would see as better lifestyle choices?
I think having that awareness, and it's not to scare people, but having that awareness of what can happen if a lot of these chronic diseases reach the stage of complications happening, at least gives you that motivation of why you need to prevent getting to that stage in the first place. So that should be one of your drivers. I guess another driver is just that actually living a healthy lifestyle can be very fulfilling as well. If you break down the elements of that, eating well, exercising, these are all quite fulfilling things to do as a human being. So that should be a driver as well, just wanting to live a fulfilling sort of life as well. So I guess then you've got almost the positive driver and the negative driver almost as to why I should live healthy and try and prevent these things. To be honest, like you said, most people, they want to live till they're much, much older. But the caveat to that is you want to live older and you want to be walking around. You want to be playing with your grandkids, your great grandkids, and all that stuff. You don't want to be you're old and you're sat there. You can't do anything. No one wants that. So exactly. So I think I always think about chronic disease as cumulative. You start early and you carry on. Do you know what I mean? And those, it's not that you had KFC today, so all right, cool. Now you're gonna have heart failure, or, ischemic heart disease, and no, it's
cumulative effects of small
things. So I think people need to have that mindset of it's a slow burner. Let me start now in small ways and then go from there. I was thinking as well, one key thing is, because obviously we've spoken about the comorbidities, spoken about the complications, etc. But especially from the diabetes point of view, what are the general sort of things someone should look out for? Do you know what I mean? Because it has its own set of symptoms that, for us are quite simple.
Yeah.
Other people might not really know what diabetes presents with. So they could be experiencing certain things. They think it's normal. It's
true.
Yeah. So
I think we mentioned on the opposite, another episode, fatigue.
Yes.
Fatigue being a very non-specific symptom.
Yeah.
But if you tie in fatigue with extreme thirst, always feeling thirsty, urinating, excessive urination, those are things that would make you consider this patient might be at risk of diabetes. That's probably those more in the acute stages. Acute stages.
Okay. Let's move on from diabetes. I think one other relevant one, and it might be a bit of a tenuous link, but something like a COPD, and the COPD basically. So COPD, for everyone at home, is chronic obstructive pulmonary disease.
Obstructive.
Huh?
I'm joking.
Listen.
Yeah,
I know my stuff. Don't worry about it. But basically, it's a type of lung disorder, which you commonly see in people who have a long smoking history. And the reason why I bring it up is obviously smoking.
Yeah,
definitely as a society, people have reduced their smoking. Vaping, on the other hand, and obviously vaping, you have different types, etc. So it's not to say that vaping is going to lead to COPD.
Okay.
We haven't even got enough research to even back that up at the moment. But obviously it's relatable because it is something that the prevalence of has increased. So I think even COPD and smoking, etc., is still worthwhile touching on, even though smoking, I guess, is not really a problem as much as it would have been, 30, 40 years ago. It's easy advice, I guess, as well, but not easy advice, as all these things are. Because if you just say to someone, stop smoking,
it doesn't work.
No, it doesn't work.
It doesn't work.
If you say stop vaping, doesn't work.
It doesn't work.
These are all addictive things.
Yeah.
But what's the general advice in terms of that? What is the complications, as we've done with the others, that you might sort of see in COPD as well? Because like the other sort of things we've described, can be very debilitating in the final stages as well. So what would you say? What's the general advice in that, from that sort of domain?
In terms of smoking?
Yeah.
With smoking, I would say, advice is to stop or reduce. And if you need assistance, then either you can have nicotine replacement or you can see your GP who can maybe forward you to some smoking cessation services. Because with smoking, like you've mentioned, COPD, very debilitating, essentially will have a huge effect on your exercise tolerance, predispose you to infections. And, with these infections, your lung reserve gets affected.
Exactly,
And also the risk of cancer as well.
Massively as well.
So it's a tough one, because this is where autonomy comes into it, whereby you can only give people information.
It's true, and then they do what they please with it, really.
You can give them information in a unjudgmental manner. It's not a case of, if you don't do what I say, you're wrong for not doing what I say. This is the information. It's up to you to make that decision, because some people get immense pleasure from smoking.
It's true.
Or if they stop smoking, what are they going to replace that habit?
It's true.
There's nothing to replace.
Hence where the vaping and thing comes in, really.
Or they might replace it with something else. It could be alcohol.
It's true.
It could be sweets. So it's a difficult one. Sometimes you need to give people that the grace. Options, and then respect the decision they make, but then let them know you can change your mind at any time. If you want to come and speak to me about it again, I'm not going to say, well, didn't I tell you before? No, sometimes people need a number of
checkups and
before they're actually really going to
stop that.
It's true. It's true. Smoking, I would say stop. I don't smoke. I don't even do shisha.
That's it. This guy's boring, man. No, actually, I don't do future. No, it's true. It's true.
But so I think we also wanted to touch on another important screening program.
Yeah.
The bowel cancer.
Yes. I was going to go into that. Yeah.
Which people are invited between the ages of 60 to 74.
Yeah.
I believe it's every 2 years.
Yeah.
And they've started expanding it with a plan to invite people from as early as 50.
Yeah.
And
invite them for what though?
For a fit test.
Yes.
So
okay, fit test. This guy said fit test.
So fit test is essentially they test your stools for blood.
Yeah.
And if it's positive, then the chances are they may need to do further tests.
Exactly.
And I guess you can have blood in your stool for more reasons
than just bowel cancer. Yeah. So that's one key thing as well, I guess.
Also, you might not have blood in your stool.
Exactly.
So it's screening programs aren't perfect.
Yeah.
But they're there to try to capture people.
Exactly, from slipping through the net.
Yeah.
Definitely. And it's I think there's a lot of anxiety about sort of bowel cancer testing, I guess, as well. I think a lot of people are scared of having colonoscopies and, camera up the bum and all that.
PRs.
Yeah, and PR examination. When you get patients coming in and you need to do a PR examination, people are apologizing to me. And I'm thinking, no. And a PR examination basically is when you examine someone's rectum. But obviously as professionals, it's not a problem at all.
Yeah.
But there is that anxiety you see in people that they don't want that done. And the stool
you start
test,
looking at your fingers.
exactly, like what's the shape and size? And obviously the fit test is trying to avoid unnecessary colonoscopies as well. It's just a stool test, so it's much easier for people to do. I guess one of the key sort of things is what are the things that people need to look out for really as well, symptom-wise, to even prompt them that, okay, let me go and see my GP and get this fit test done.
Well, the fit test, they should be invited for the fit test.
But even then still,
because, okay, let's say hypothetically you get your first invitation at 60 or let's say it's at the earlier age of 50. If you have the symptoms, you shouldn't necessarily wait. Because it's trying to capture people who are asymptomatic.
Definitely.
So if the key one is blood in your stool, changing bowel habits, fatigue, because through that blood loss, you might have developed anemia, which can be making you more tired. And abdominal discomfort, feeling like you're not properly emptying
your bowels,
weight loss.
With no sort of unintentional weight loss.
Weight loss.
Trying to lose weight. You're not going to the gym or anything. Now your trousers are baggy. You don't even know why.
So those kind of symptoms, you shouldn't sleep on them. Because timely diagnosis
is the key thing.
Is very important.
Definitely. And I think it's probably relevant. I guess, I've had people come and ask me about bowel cancer, more so from the point of view of, you've had recently famous celebrities dying of bowel cancer, and so I think in the black community is something that people are now starting to think, okay, what's that? One thing I guess is that in some populations there are going to be genetic factors that increase your likelihood of having bowel cancer, I guess, later on in life. Those sort of people obviously will have screening earlier. They'll have a different. They won't fit into the normal national screening. They'll be screened much earlier in their life. But I think it's an important one. Prostate cancer we'll touch on, I guess, but there's no screening program with that, I guess. But prostate cancer is another one, and only because it's again relevant in sort of especially the black community as well. That one, I guess, is different because you would probably go to your GP and ask for the testing to be done, really. And there's not really an official sort of at a certain age bring people in.
And what symptoms would?
So it's gonna be urinary symptoms really as well. So you're gonna be passing urine a lot during the night time. You're gonna be passing
some blood.
Exactly, you might notice some blood when you pass urine. Again, might have that sensation of not emptying, but this time urinary wise. So when you pass urine, you don't feel as though you're emptying that well. And then even during the day, you might be passing urine more frequently as well.
And that's essentially because the prostate is an organ that surrounds the tube that drains urine essentially.
Exactly. So that will sort of compress on it and sort of produce those urinary symptoms. And with all things, to be honest, any sort of unintentional weight loss, you need to be checking that, because that in itself is not normal, but you'll have that as well.
And I think what's important here is, obviously as men, if you've got an issue downstairs,
let's go and check that, please.
No, but but we're probably, especially African men.
Yeah.
If we think of our parents.
Yeah.
That's gonna be something that they're gonna be very touchy about.
Yeah,
you know?
yeah. They don't want to talk to
Talking to
anybody
someone
about that.
about when they're doing the number 2.
Yeah.
Or struggling to pass urine.
It's true.
But it's better to go and have that conversation.
Yeah.
Get a timely diagnosis than wait.
Exactly.
And then, because the thing is, even if you wait, it's not to say that it's going to be too late. But what may need to be done may be more invasive than if it was a timely diagnosis.
Yeah, it's true.
So it can't be stressed.
Yeah.
It can't be stressed enough. Like delaying seeking medical intervention.
It's never good.
It's not good. And to the same extent, trying to reduce unhealthy habits.
Yeah.
Yeah.
And I think people need to be reassured. Listen, your GP is happy that you're coming.
Yeah.
Do you know what I mean? They're happy that you're coming. They're not thinking he's talking about passing stool and nobody's GP is going to be uncomfortable.
We have that conversation
all the time. So definitely, people should feel encouraged almost and have that boldness. I always say to people that keep the threshold low, do you know what I mean? To get checks and things like that, definitely.
All right, guys, we've got some questions from the Goodman community.
This one's jokes, go on.
First question. I'm approaching 45 this year. My missus has reminded me that I need to get my colon checked.
Okay.
I know it might be immature, but man don't want a finger up there.
Up where?
Is there an alternative?
No, up where? Answer the question. So there is an alternative, but obviously the bigger thing is, does this guy have symptoms or not? Realistically, because he's only 45. Exactly. So he wouldn't really fit into the national screening.
Not in the UK.
Exactly, not in the UK. But if he's got symptoms, first and foremost, so we touched on those. So blood in your stool, if you've had a change in bowel habits, weight loss, fatigue, those general sort of symptoms that might be something a bit more sinister going on. You need to go to your GP. I mean, if you're scared of finger up your ass, do you know what I mean? I've got bad news to tell you, because they're probably going to do if you've got blood in stool and things like that. But
what's worse?
What's worse? And it's not that bad. It's not that bad, to be honest. I'm saying like I've had it, but it's not that bad. So definitely go get checked. They probably will do an initial sort of stool test first, just to see if there's blood in the stool. But yeah, you can definitely avoid, I guess, the camera test, depending on what your result is like. Finger up the bum, I can't save you.
Second question. I'm not going to lie. After watching your first episode, I think I need to go see my GP and say hello after about 10 years.
I said hello. Adele, yeah?
But I'm not going to lie. I've got mad anxiety at the thought I'm going to die. What can I do to get over it?
Okay. So I think generally speaking, I don't know about you, but black people and healthcare, there's some weird, let me not say weird, because maybe people have genuine sort of concerns, but I think there's genuine health anxiety. And then aside from health anxiety, personal health anxiety, there's anxiety about even interacting with healthcare as well.
Yeah.
You'll hear aunties and uncles kind of like, why are you going to the doctors? If you're scared of this thing, when you go, then they'll find it.
Exactly.
And it's like,
as if to say,
speak it, and it's like, come on, man, it doesn't work like that. So I think people need to look at it more so from the point of view of, I'm going to go and check something. If there is something wrong, at least I've sought medical care earlier. I've seen this thing earlier. The investigations that are needed can get put in place, etc. As opposed to sitting at home, your symptoms are getting worse and worse and worse and worse and worse. You're saying, no, it's nothing. Let me not go to the doctors. So I think anxiety is understandable. It's understandable. It's natural, But I think people should feel empowered that, listen, when you go, you're going to get things checked.
Yeah.
You'll leave probably more reassured. It's better to know things than to not know.
The
Exactly.
fear of the unknown.
Exactly.
Is more dangerous.
Exactly.
I think.
Exactly. So I think definitely seek your medical assistance. Definitely, don't leave that.
Yeah. Your doctor's a friendly face, especially if they.
I'm friendly. I don't know this one.
So last question, Kel.
Yeah.
So as we know, right now it's the month of Ramadan.
Yeah.
What advice would you give to our brothers and sisters currently fasting?
First off, big up everyone who's fasting at the moment. It's not easy, boy, but I'm going to throw that to you. What advice would you give?
I'm going to throw it back to you.
No, I'm not going to answer. No, we're playing. I think generally what we've touched on is, still maintaining healthy eating habits during the period as well. And I know it's easy. I don't fast. I'm not Muslim, but it's easy for me to say, eat healthy, etc., etc. When you've gone fasting through the whole day and you're now breaking, you want to eat something that's going to taste nice. You want to eat something that you feel is going to fill you up properly. But you still need to keep in mind, keep the fruits, vegetables, etc. In your diet as well. Carbohydrates are fine, but more so slow release carbohydrates, if anything, just because that will give you more satiety. That will make sure that you're full up for longer periods as well. Proteins as well will fill you up and make sure that you're full up for longer periods as well. Just so as you are entering the fast for the next day, you're feeling a little bit more full up from that point of view as well. Obviously, binge eating and things, the problem is you might have that spike in energy immediately, but it's the likelihood is you're going to be feeling a bit rubbish later on, probably going to be a bit more hungry as well. So it might be trickier for you as well. But what would you say?
I think that's all. Yeah, all reasonable. I think someone asked about multivitamins. Yeah. I think, like I tend to say, if your diet's balanced, you've got no issues affecting your absorption. You're not on any medications affecting your ability to absorb certain macronutrients.
Should be good, yeah.
Should be good.
And it's quite acute as well. Obviously you're fasting, but it's not. It's probably not long enough to cause any sort of deficiencies long term. So yeah, trying to maintain as much as you can a balanced diet should be okay. It should be enough, and stay hydrated as well in that initial period as well when you can eat and drink as well. Guys, thank you very, very much again. Tuning into this episode of Goodman Factory presents Checking In with myself, Kel and Aleem. I hope you've got something from this. Again, thank you very, very much to those who are leaving comments, liking, interacting. More of that. We need more of that. So as I said, subscribe, leave comments, leave questions. We'll be back again. More episodes, more content, more Vim. We'll see you, yeah?